So for root canals, it's not that bad. Most people are scared of root canals. They don't want to know. They don't want to be told they need a root canal. Root canals really got a bad name, or get a bad name, because a lot of times by the time the tooth needs a root canal, you're in so much pain, and occasionally there's nothing that can be done to get you numb. And that's where that kind of misconception that the root canal is going to hurt came from, because occasionally, and very, very rarely anymore, but occasionally, yeah, you'll have a tooth that can't get numb. If that's the case, 99.9% of the time I'm going to send you to a specialist, because if I can't get you numb, then there's some other things that need to happen, and that specialist has other techniques that they can do to make sure that you are pain-free during the procedure. But the modern root canal now, they have 3D technology where they can actually go in and look at all the shapes in the canals, and it goes a lot quicker. I do simple root canals. If they're extensive and complicated, a lot of times I will send to a specialist for 2 reasons. Number one, I want to make sure it's done right and done once. There's nothing worse than having somebody get a root canal, whether I did it or whether some other dentist did it or whether a specialist did it, and a few years later having more pain or having a recurrent infection, and then having to tell somebody, well, you need to have that root canal redone. And the look on their face is, what are you talking about? I have to have it redone? So for us, root canal services are usually the simplest ones are done in our office, and the other ones are done by a group of specialists that we really, really trust, and I would let do root canals on me if I needed one, and it's kind of one of the ways that I've decided to practice.